Hello, I'm Seán Amesbury, and today we're going to be covering burn injuries and the related sepsis. Now, our subject for today is going to be this paper fellow. When I asked Mr. Morrell what I should name him, he simply stated Dubai Tuesday. So his name is going to be Dubai Tuesday. We're going to be assuming that Dubai is a healthy young man for the related injuries that comes from a severe flame he's soon going to be in contact with. Look out. Oh God. Dubai has survived his incident, so now we shall assess his sustained injuries. Keep in mind Dubai's injuries may not be a completely accurate depiction and are instead an educational tool to compare the different degrees of burns. First, we will assess the least damaged part of Dubai. Here he is suffering a first-degree burn, characterized by red and painful skin. There are no blisters, and swelling in the wounded tissue is minimal. Below his first-degree burn, Dubai expresses a second-degree burn. Second-degree burns are also characterized by red and painful skin, but are also accompanied by painful blisters and edema. Below the second-degree burn, there is a third-degree burn. There is no pain because the pain receptors have been destroyed through the burn. Blood vessels, sweat glands, sebaceous glands, and hair follicles are also destroyed. Under the third-degree burn, all along Dubai's hand, there is a fourth-degree burn, which can expose muscle, fascia, and bone. The degrees of burns are associated with the layers of skin affected. The first-degree burn would be expressed only through the epidermis. Second degree would go into the dermis, third degree into the subcutaneous tissue, and fourth degree into the muscle and possibly bone. This is what an average healthy skin would look like. But a first-degree burn would express a redness on the epidermis that is affected. It would be painful and perhaps itchy, but overall superficial. A second-degree burn would look something more like this, with fluid deposited under the epidermis above the dermis, and swelling would occur on the top layer. Redness and itchiness would also be accompanied with this, and if enough pressure is applied, this fluid can burst. A third-degree burn, however, would cut right through the epidermis, the dermis, and the subcutaneous tissue, exposing muscle and veins. It would be accompanied by a blackish, reddish, or ashen appearance on the top layer. A fourth-degree burn then would cut through that muscle and perhaps even expose bone. Pain for both third-degree and fourth-degree burns would be minimal, seeing as the pain receptors are burned through. To measure the area of burn, it is often used as a percentage of the body's total skin area. The skin area of each arm is about 9%, each leg is 18%, the trunk itself is 18% in the front, and in the back, a total of 36%. The head is also 9%. It can be safely assumed that Dubai will survive this incident, having the third-degree and fourth-degree burns affecting less than 20% of his body. He will, however, need medical attention. Severe burns will cause immediate nervous shock. A victim from this will grow pale and disoriented, and may even faint from the pain. The more dangerous part of this is the secondary shock that comes hours later. It will cause a dramatic fall in blood pressure, and will lead to cold extremities and eventual collapse. First and foremost, Dubai will need fluid resuscitation. He has lost and will continue losing fluids from the damaged skin. In a burn ward, Dubai's injuries can be properly washed and dressed. Closing the wound as soon as possible is necessary to avoid infection and further damage to other tissue. Dubai's third and fourth degree injuries will need either skin grafting or amputation, but seeing as less than 20% of his body is affected by these burns, skin grafting is probably an appropriate treatment. Infections are one of the most serious complications of burns. To prevent such infections, frequent washing and dressing is done, and medical physicians often check the fluids of the affected areas for any infections present. If any infections are present, treatment is quickly administered with antibiotics through fluid transfusions. Dubai is finally at the hospital. Prep him for surgical debridement. Get those fluids in him. Dress his wounds. You will be healed.